just to give you a little background, at NC State we have a group of researchers. It's a very multidisciplinary group that's been looking at privacy for about 8 years now. My background is in software engineering, and so I've been applying my work in the area of privacy policy, legal compliance, etc. And we're very motivated to do this because much of what we do today involves information and the exchange of information. And clearly we want to help people understand how we're safeguarding their privacy, and we want to develop methods and techniques and tools that enable us to safeguard people's privacy. So just a quick outline, because I'm a professor and we like to provide an outline. So I'm going to talk a little bit about why we care about transparency and privacy, and then I'll talk a little bit about some of the research that we've done. And finally, I'll close with some recommendations. So why do we care about transparency? Well, transparency increases accountability, and that's a good thing. One of my favorite definitions is from Anton, a law firm, that says transparency requires privacy notices that are easy to read, facilitate comparison, and are actionable. Privacy notices must also comply with legal requirements. I'll show you this statement again throughout my presentation. So medical privacy in particular is very interesting. A lot of people might have some medical condition that has a stigma associated with it. And they're willing to sometimes pay for treatment out of pocket to keep that stigma from showing up on their personal records, and to make sure their insurance company doesn't find out about it. And in addition to that, some patients withhold information and don't give a physician the complete picture, and so they're getting the wrong kind of treatment for something that might be really, really critical and important. And when we live in a society like that, clearly that means that people don't believe that there's transparency and also are concerned about how we're safeguarding their information. And HIPAA requires healthcare providers to secure information, but clearly we're not quite there yet. And we don't want this to happen. Right? DNA doesn't match your credit history, but that might be where we're headed. And there are concerns about healthcare privacy in the United States. There was a GAO report that showed that over 40% of federal health insurance contractors and state Medicaid agencies recorded experiencing a privacy breach involving personal health information in the past 2 years. And then consider also, we've heard a little bit about this today, data mining for anti-terrorism. When airlines share passenger name records with the Department of Homeland Security. And then we have the Choice Point, Bank of America, and numerous other data thefts. And all of these have been perceived as violations of privacy, and all have provoked public dismay and protest. So